Thanks, Deb. Speaking of trying something new, we're here with Dr. Katie Lays from Aspen Dental, and she's going to tell us about a brand new a dental program, just a kind of a fun new idea. Good morning, Doctor.
Good morning.
So tell us about the SMILE program.
Well, Aspen Dental is teaming up with Oral Health of America, and it's because of the incidence of oral conditions with older adults, and we're trying to educate older adults on oral health concerns. What we're doing is, along with the education, is we're also offering an incentive for patients to come in and get their dental treatment done, 20% off of dental treatment during the month of September for all new Aspen Dental patients.
So all you have to do is mention that you saw it here, or you saw the SMILE.
Yep.
What's this new SMILE program all about?
Yeah, a lifelong smile, and again, it's Aspen Dental and Oral Health of America.
Very cool. All right, let's talk a little bit about, I think people think, it's important to brush your teeth and take good care of your teeth because then you'll have wonderful, healthy teeth. But it goes way deeper than that.
Right. There's a big link between oral health and common health conditions such as diabetes, stroke, cardiovascular disease. The British Medical Journal actually just did a recent study about how increased poor oral hygiene has an increased effect on cardiovascular disease and inflammatory disease. And the NYU actually just did a study that gum disease has a problem or increased risk of cognitive disorder associated with Alzheimer's disease.
Wow. What about, who would be at risk for gum disease? Is it an age group?
Well, actually everyone's at risk for gum disease. 3 out of 4 Americans are actually afflicted with this disease and don't even know about it. But older Americans are at increased risk for severe gum disease.
Well, what are some of the signs, or what are some of the changes that people see, along the way?
Well, obviously receding gum lines. You hear about long in the tooth.
Okay.
And that also increases the vulnerability of root exposure, which inflammation and cavity production too.
So what kinds of things can you do right now? I mean, what kind of advice do you have in terms of, making sure all your ducks in a row so this doesn't happen?
Obviously brushing twice a day and flossing, seeing your dental care professional at least twice a year.
People put that off. I happen to be one of those every once in a while, and I think that's so important. You take care of everybody else and all, make sure your kids go to the dentist and all that kind of stuff, and sometimes we're the last one to go.
Well, another problem is 50 million Americans wear dentures, and they get their dentures and they don't go see a dentist for 50 years. Oral cancer, increased risk. A lot of the medications I use, ranging from high blood pressure to antidepressants, can cause dry mouth, which can cause all sorts of problems too. So even if you don't have natural teeth, going to see your dentist to make sure that your oral health is maintained, as well as your general health too.
Good point. Tell us about Aspen Dental. Where are you guys? What do you do it all pretty much?
Yeah, we're located, I believe, in 28 states now. There's 280 offices in the Fox Valley area. There's quite a few offices too: Fond du Lac, Appleton, Oshkosh, also up north, Wausau and Stevens Point area.
Okay.
We're open later hours, like today. We're open till 8.
Oh, that's nice for people after work. Okay.
Yeah, and also Saturdays, selective Saturdays we're open. Like this Saturday, we're open.
Wonderful. All right. Thanks so much. Good advice. Appreciate it.
No problem. Thank you for having me.
No.